So I guess from your perspective, I know they started reaching out in July, the city council. What's kind of happened in the last with this whole situation?
Well, in July, my operations officer went to a meeting to discuss a CDBG grant, which is a HUD grant, a federal grant, to get an extension. And during that time, they said they would like to talk to us about layoffs, some layoffs we had here. But they never contacted us until later. So when they did start to contact us, what really the issue is that the city is under the Open Meetings Act, which means all of their business is done in the open and they discuss things. We're a private company that's funded by federal government, and so we're not subjected to that. So we would essentially, my board chair and I would be essentially going to meeting and saying a lot of, we can't answer that, we can't answer that. So it didn't really seem practical. Now we're open to speaking to them. In fact, we invited them here. And then we were told, well, they can't come because then it would be the Opens Meeting Act. But a couple of them could come and just discuss the issues and then take the information back. But there's been an unwillingness to do that. But in spite of that, we still reached out and said, we're still here if you want to come visit and talk to us, and we still are.
My understanding
Hold
is...
on 1 second. Can I just move
Something
this?
like, yeah?
It's just hitting your scarf and then it's like kind of scratching.
Okay,
Cool. Thank you.
thanks for fixing me up.
And so they've kind of said something very similar, that they've reached out and said, a couple of us can talk to you, and it hasn't happened. So
There's never been any discussion that two would come here, because we would have set that up a long time ago.
okay. And so I guess they were wondering about, why you guys have moved west and had to lay people off. What are the answers to those questions?
Well, first of all, the grant for the $1 million for a renovation of a site west of here, we applied for that almost a year and a half ago. And it's a competitive grant. So the first group received grants, and then the federal government said, your grant was really great. If we have more money, then we will fund you. It was just the timing. The funding came a little bit later. We would have already been over there had the timing been better. However, 19% of our patients live west of here. So they drive 45 minutes to an hour to get services. So it only makes sense that we get services closer to them, because then they'll be more compliant. I mean, money that they could use for prescriptions, they're spending in gas. I mean, there's just all sorts of psychosocial issues that would be helpful. By those individuals moving west of the I, that would open up space here where our staff could spread out a little bit more, and they could use more rooms. And if you have more rooms per provider, you can see more patients. So more people in Kenosha would be taken care of.
And one of their other concerns is layoffs that have happened, not having staff but wanting to expand. Why have those layoffs been taking place?
We had some dentists that left, and there is a shortage across the nation of dentists, family practitioners, and psychiatrists. There's some other things, but those are big issues here in Kenosha. So the doctors left. It takes time to recruit, and it's taken longer now because of the shortages. We now can tell you that we've hired, since the layoffs, 5 dentists. So 2 are already on site. 1 starts next week. 1 starts January 2nd, and 1 will be here in March. So this issue will pretty much clear itself up shortly. And we've been spending every spare moment trying to get dentists, and we're very happy that we have them. Just to keep in mind, there's 50,000 low-income people in Kenosha and Kenosha County combined. We're serving about 21,500 of them. So if you think about this is not a new problem. I mean, there's never been enough dentists to meet the population. It's just, right now, it's almost like they woke up and realized that there's all these people that need dental care, and that's never changed. The private dentists don't see Medicaid here because they don't get paid well. And so that leaves it to the FQHCs across Wisconsin, across the nation, to take care of patients, which we willingly do. But there comes a point, the dentists that were left here couldn't oversee 3 hygienists. I mean, that's just too many patients, and it's not safe for the patients. So it was a decision for safety, and also it was financially responsible of us. We can't pay people that we don't have work for.
Sure. So will more hygienists be hired now?
Yes, more hygienists and dental assistants will be hired.
Okay. And so I guess the question is, where they're giving the health center federal funding through the city, why not go to the Open Meetings Act and answer those questions publicly when you guys are getting a lot of public funding?
Well, we received $26,000 from the city. It's through a HUD grant, and that was the meeting in July that my operations person went to. So we had already answered those questions. Now, if we were not in compliance with the grant or there was some issue with this grant they wanted to talk about, by all means, we should be there. We would have to be there. But we've given them more reports than we're required to do, and we've followed the grant to the letter. And we even said if you have a problem with the grant, we missed something, we'll fix it. But that has not come forward. So we're not sure where the grant comes into all of this, because we hired the psychologist to go in the room, and then we also have finished the project. So for us, it's kind of like we're not quite sure what the issue is with the grant. But if there is an issue, we'd be happy to fix it.
I think, they were saying that the center's gotten more than $600,000 over the last 10 years from the city, and they do have these questions that they'd like answered.
Mm-hmm.
Why not go and answer them?
Well, I don't know that it's that we won't answer the questions. It's just that it's broad-based. We said, why don't you send us the questions? We'll answer what is it that you'd like to know. I mean, we can't just go to a meeting and then just be bombarded with questions that we can't give them answers to. I personally don't know about the $600,000 because I've only been here 3 years, and all of that I've received is $26,000, and I should say, and then an additional $2,500 for some vouchers for services for people that didn't have money. So I can't even speak to the $600,000, and when all of this stops, I'll go do some research and figure out what that was about, because it's a large amount of money, without a doubt.
And so why not go, if you're getting public money at all, why not go answer in a public forum any questions that they have?
Well, because we're a private company that my supervisors are board, so it's the board of directors that runs this, and they're all volunteers. So we're not subjected to that. And I couldn't even answer the questions they would have on $600,000 because I don't know what those issues are. I mean, I would have to do research, to be honest with you, because I wasn't here.
Do you feel obligated to the public to answer some questions that, these representatives of people have in a public forum?
No, I don't feel obligated. We answered the questions in a public forum regarding the CDBG grant, which was federal money. So we had no problem doing that. So beyond that, I'm not quite sure what we would be answering.
They said they've gotten a lot of complaints about the actual care that people have gotten, inability to get appointments, if they've had work done and then something goes wrong. They said that they've heard that a lot of people can't get back in to address those concerns.
Well, that would be true, but it's not a new issue. I mean, since the center was built back in 2008, people haven't been able to get in the center, and they haven't always had their treatment completed for a number of reasons. One is in the beginning, people just were being scheduled because the demand was so much because they had no health care here. So this center stepped in and started the program. So at that point, it's like, okay, we got these appointments, let's just fill them up. Well, when you fill your appointments with all these new people, and keep in mind, we're talking that we have the capacity for 21,500 people, and you've got 50,000 low income that don't have insurance or have limited insurance. We would never be able to do it, and there isn't any health center that can meet all the demand. Now, what we did do is we've changed our schedule so that they can complete treatments. So new patients now are having trouble getting in, so we can bring people back so they can complete the treatment, because when I came here, that was a big concern of the dentist. They come in and I'm diagnosing them and I can't treat. So how do we fix this problem? Well, we have to limit the number of new people to get in. Once you finish the treatment, then you can open a slot. So it's very complex. And keep in mind, we're in 19 schools for dental care in the city here, and 3 schools west of here with portable equipment, and then we have the dental facility. So we do a lot. We do bridges, we do crowns, root canals, everything here. So it's demand and supply. I need twice as many dentists to take care of the patients here, and we will never be able to hire that many dentists.
Do you think that the center has a continuity of care issue?
No, I don't think so at all.
Did you listen to any of there was a hearing about the center on November 21st. Did you listen to any of that or go to any of that?
I did. There was 2 patients that came. One had said that her child had braces, if I remember, and then she tried to get in to get cavities at that time, and she couldn't get them finished. But if that was before I got here, before we implemented this process, it could be true. But what I would recommend is that that individual call us, and I've put our phone number, my personal assistant's phone number, in newspapers, and every time I talk to someone, if they call, then we could research it and find out what happened and help her. You know, if the patients just go to the alderman with their concern, and the aldermen don't bring them forward to us, nobody gets help. But we're the only ones that can help them. So really, you need to bring that to us. So if they have a name, just call and we'll look into it and we'll get them in when we can. I mean, that's our job. I mean, that's what we're here for.
Do you think that's what they were trying to do by asking you guys to come to the public forum?
I don't know. It was very wide open. We're here to talk about your operations. I don't call them here to talk about their operations, if you follow me. So it's kind of, I'm so busy every day taking care of things here, I'm not quite sure why I would call them, but I just didn't understand why they needed us there.
Do you think that's a bit different, them calling on you versus you calling on them to talk about operations?
Well, it's just not unheard of. I mean, I wouldn't go to any of my colleagues and say, let's sit down and you tell me about your operations, unless we were maybe at a seminar and we were talking about ways to improve services, but it's just not common. You know, I wouldn't go to another business and say, hey, tell me about your operations.
If you paid part of their salary, then would you feel like...
But they didn't pay part of the salary.
But they paid for facilities and...
Well, again, I don't know what that $600,000 was. The $26,000 was for a room for a psychologist to see patients. So I can't think of any reason that we would have to spend this much time on it, to be honest. For me, we could just be doing what you and I are doing, sitting down, let's figure out what this problem is and let's resolve it. I mean, to me, it's that simple. So I think we should do that.
They seem to think that you're not very open to sitting down with them and having this conversation.
I've heard that, but I've never met Mr. Bogdala, for instance. He's never called. I've never seen him. So, Mr. Kennedy, we met with 3 times already this year. We have an open house every year in which we share all of our quality indicators. We share our financial indicators, and anybody in the public can come to that. It's National Health Center Week, and we are very open and share that data. Mr. Kennedy from the Alderman Kennedy came. He shared the data. He had questions on our finances. We were very open and answered them.
He still, I spoke with him earlier, and he still indicated to me that he believes there are management and communication issues going on.
Well, unless we talk, we won't know what he's talking about, right? I mean, that's part of it. I mean, it's a two-way street. You have to listen and you have to speak, and it's not working very well for either party.
Right. I mean, they tried to subpoena you guys to come in and talk with them.
Well, they can't subpoena us, number one. What they told us in that November 21st meeting is that we're inviting you to a meeting. But before that, they're telling the public it was a legal summons, which it was not, so we should clear that up. Then they wanted to send a policeman here to drop off an invitation to come to the meeting, but they were told they couldn't send the policeman to do that. They couldn't use city resources to do that. So then they sent a server here. And, you know, I'm at a meeting outside, my board president doesn't work here. Someone tried to tell me that and they threw the papers at her. I don't find that to be a cordial meeting. You know, to me that's bullying. And I don't think anybody would accept that. That's not an invitation to a meeting. That's not how I invite people to come see me or sit down with me. I would expect the same courtesy.
Why not just show up? I mean, I don't think, you know, if you had gone maybe earlier in this process, we might not even be having this conversation right now. Why not just...
Well, I would disagree with that because my operations person had already met with them. So, and we had met Mr. Kennedy at our open house right after that in August. So, what is the real issue? And I think only they can tell us what the issue is.
Having just spoken with the alderman, he seemed to have issues with some of the treatment that's going on and not getting answers to questions.
Treatment to who?
Some of there was treatment of employees that he was concerned about and treatment of patients as well.
You know, we have an outstanding group of providers. They're well educated, they're credentialed, their heart is in this work. They do excellent work. And in fact, they do procedures in particular in our dental department that private dentists don't do. For instance, we do root canals other dentists send you to a specialist to get that done. So I stand by my providers, I stand by the quality of care here, and we just had a site visit from HRSA in March, and they raved about our quality program. So I think that I could say that there's probably a patient that all of us know in our lives that had a complaint, right? But if you want to do something about it, you need to bring it to the person that can help them. But if you're thinking there's these big long lines of people that are upset, we haven't seen them. I mean, we didn't see them at the meeting. They're not lined up here. So I would welcome to talk to them. Because our job's to help the patient. I mean, we wouldn't want anybody to be hurting out there. But there are people every day with medical conditions, dental conditions, behavioral health conditions that aren't treated. So we're talking about the fact that we don't have the capacity to treat them because we don't have dentists, but who else is helping? I mean, this is a bigger problem than the fact that we lost a couple dentists we now have replaced, and we're still saying that there's a problem here at the center. There's a problem across the nation, and that's the real story.
Will you comply with a federal investigation?
Well, if I'm told to, of course I will comply, but I don't consider this, whatever they're asking for, a federal investigation, because every 18 months, the federal government is here reviewing us. And that happens to every health center. So for us, it's just part of the work we do. So to me, it's no different than when they came in March. I mean, if they tell us they're going to come, they come. I mean, we get audited by all sorts of people. It's part of our work.
Why do you think it's come to this?
Why has it come to this? I have no idea, because like you and I are having a nice conversation, we could do the same. And we should do the same.
Let's see if there's anything else. So I understand that they got a letter from your attorneys, saying that you wouldn't come to a meeting.
Well, that letter was the same one when they said they summons us. So part of it is if you tell people you have a legal summons, most people will get an attorney involved. So if you do that, then you shouldn't be surprised there's an attorney involved, right? I mean, if I gave someone some kind of, I said, okay, here, I'm going to sue you or whatever it is, they're going to get an attorney. So I don't know why this was a surprise. We had an attorney involved.
Up until that point, why not answer their questions?
The only time they talked to our staff was in July. And then in August, when we had our open house, we answered those questions at our open forum for the community. There was no communication until this letter, this invitation.
They hadn't spoken to you up until
They
then
they did not speak to me at all. I received a phone call to meet with them, and I asked them, what are we going to talk about? They said the layoffs. They said, we're not going to talk about the layoffs, right? And I asked them too, do you bring every nonprofit, every company in Kenosha to your meeting to explain their layoffs? I mean, it's our business. Our job is to be financially responsible so we can take care of as many people as we can. Why would I have to come in and explain that? That's part of the work we do.
When was that phone call?
Probably around August maybe. Gosh, I couldn't even give you an exact date right now. I remember July because Alan went, and I know when our open house was in August. So somewhere in between there. But we talked to Tony Galex, who's there, who works with us on the grant. He went back and forth with them, and they said they couldn't come here because of they'd have to have an open meeting, and we said we weren't going to go to an open meeting to discuss our layoffs, and if they wanted to talk, we would be happy to have a couple people come and talk to us.
Why not go to an open meeting? Because
there is information. I mean, the information we do has a lot of personal health information. I mean, we're under a lot of HIPAA and compliance that we have to monitor. So there's many things we can't talk about. And I don't think anybody wants to stand there or sit there all night and say, I can't answer that, because you still don't look like you're answering questions, right? So why not just give the questions to us? We can agree on what we can talk about and sit down and talk about it.
Do they have an interest and a right to know, because you do receive some funding for whatever it is from the city and from the federal government?
Mm-mm.
Why not?
Well, I guess I would ask why. You know, we receive money to manage the health center, to manage patients, because this is more about the patients we serve. And we spend very little time during these conversations talking about the patients. So I would love to have a conversation about the patient and how we can serve them collectively.
Which would be how?
They could come and sit down. I mean, we could go there and sit down with a couple people, but I don't think we're going to problem solve how to take care of patients in an open meeting. You know, I don't know if you know that 51% of the patients at the health center board, 51% of our board is to be patients of the health center. And so they bring back the information to us of their needs. And that's how the federal government set this up. They set this up so the board of directors manages this operations, not the city, not the federal government. We have to be within their guidelines, but they're not even telling us how to run the place. They leave that with the board of directors here. So we should follow the way it was set up. It's like we're being asked to fit into city government and we're not city government. I mean, any more than Uline would be, or Amazon, or Aurora, or any other
Are those
private
companies
place.
getting funding from the
Aurora
city?
gets city funding. I don't know about Uline. They might get curbs and sidewalks and all those things. I mean, there's all sorts of things that go in the city. So I would say they probably do get some tax benefits, but I don't see that they're coming up and explaining their operations.
Why do you think that there are concerns about the management here?
I don't know.
Have you gotten complaints from employees or from patients?
Patients have an opportunity to fill out a patient's survey, and so if a patient has a concern, we review those concerns and we let them know that we're reviewing it, and if we're able to respond to them, we do. That's just part of the work that we do. As far as the employees have a process that if they have a concern within their work area, they go to their supervisor. Supervisor can't answer it, then they can bump it up to a manager. If the manager can't, then they usually have an administrative person that's assigned to whatever group this might affect. If that's not resolved, they can go to HR. If HR can't resolve it, then they come to me. And if I can't help resolve it, then they can go to the board. So I can tell you that process I've not had anybody come up to me or to the board. So that's what I can speak to. So I think my staff's doing a good job of managing whatever the concerns are. But that's how they manage, most places manage their process. They don't go to city government, they work internally to resolve their issues.
Do you think maybe that's been a last resort for people who haven't found success in that process?
Well, you can't have success if you don't use it.
Anything else that you want to add?
Well, I'd just like to add that I think that all of this negativity is not good for the patients. We are considered the safety net for people that do not have health insurance, refugees, all sorts of patients. And when this type of stuff starts going, it just keeps talking about it, federal investigations, all of these things, it scares people. And that bothers me a lot. We should not be scaring people that need health care. And it's incumbent on us to be adults and sit down and talk about it. And then I just really want to say again, I stand by my staff. They work hard every day. They work long hours. They take care of very complicated cases. Some of the things that were described are, one of the aldermen said last night, they should see the pain these people are in. They see people in pain every day, every hour of the day, and they get them out of that pain. So rather than saying a provider should see this, maybe they should come and see what happens here, because this is not new to us. But I could see where it would be shocking for the first time for someone to see it. But I think that there's tremendous need in this city and county, and we would be better off working together to get it done.